The next step is to encourage people and at some point recommend people to wear facial covering when they go to grocery stores and any place where gatherings are. So, and if you can't get this, let me show you what else we can do and what we need to do. As simple as having a bandana, even a coffee filter and rubber bands are an easy way to do this, or just a scarf, which I'll show you in a second. If you take a bandana and a coffee filter and put it together like this, simply fold it over once, fold it over again here, and then all you have to do is take a rubber band on each side of it, take it down all the way down till you feel the coffee filter, at least that's the way I like to do it, all the way down on this side till you feel the coffee filter, fold these in, simple as that, and take it, and you have a mask. This is all you need to do. It's protection. The filter, actually the coffee filter, will help give one added level in addition to just the bandana. This is my facial mask of choice. I recommend it to you. If not, you don't have to have gone to Yukon to wear a scarf of any sort. You can just take a scarf. I know the weather's changing. Tie it around or wrap it around. Stylish if you're stylish, but think about it. Again, this is great. This is great. This is great. But the impact of covering your face is critical now as we move forward. Thank you. Just
You're good there.
more afternoon. I always say good morning. 12:30 is kind of afternoon. So pleasure. Thanks for coming Monday. We'll go through the weekend. Some good stuff in difficult times. Some good stuff over the weekend. I think to kind of, in sports terms, move the ball up the field a little bit. I want to thank everyone, not just for joining today and for sharing. If you can, share this and get more people involved. There may be some information, I always put it this way, that someone may need that we may provide, and by you clicking share now, you may be able to help them with that information. So we had a good weekend. I think weather-wise was, again, I'm not the weatherman, but Saturday was kind of so-so, Sunday was better. So why do I even mention that? Because it impacts how we're dealing with stay at home, being able to get out, enjoy a little bit. So we'll talk about that. But we took advantage of the weather and distributed, as we talked about, an enormous amount of masks to anybody and everyone who wanted them. I want to thank the team that did that. There's a picture of one of our councilwomen, Jeanette Heron there. Well, I think that's what Scott Appleby, our emergency management coordinator. There were other council members there and other members of the administration. I know Gina was there. I know I'm missing, so I apologize. But people stepped up and 5 locations. And the goal was, I guess the goal was to give out 100,000 masks. We distributed 87,410, I guess to be exact. I always question exact numbers on that large scale, but pretty darn good. And that was on Saturday. So if you need a mask, you can still get one. I think they gave them out in lots of 10. So that's probably what you'll get if you need one. Call 203-579-3829. So why are we doing this? We're doing it because it's smart. We're doing it because it makes us safe or safer. We're doing it because we can. We feel that we have a commitment. Nobody's telling us we have to. Nobody's telling us we can't. We put ourselves as a local government, as your local government, in a position ultimately by procuring and buying enough so that we can set up for reopening, both within city government and beyond. And we want to make sure that every resident has access to facial protection. They're called masks. These are surgical masks. They're not N95 masks. They're not the most protective. But they are the protocol now, whether it's them or a facsimile. This is one that was distributed. I got a gross of these from the U.S. Conference of Mayors. They gave them to the mayors. And I give those out when I can. And, of course, you can do the bandana, which I think you probably saw a little bit earlier. So it's our pleasure. I want to go with the next round. We'll have a date on this, which we've already begun doing. 2 small businesses and restaurateurs. I know it's going to be on-off when you're eating and drinking in the restaurants, but we want the protocol to be. If we want this reopening to be successful, which it's going to be, we're going to ensure that it is, at least by every measure and means that we have locally here in the city of Bridgeport, in coordination with everything the state's doing through the governor's office and beyond. And on a multi-state level, as we're watching the other states, we're going to do everything we can for a methodical, deliberate reopening plan which begins as we talk today. But before we get there, and in order to get there healthy, physical health is important, mental health is important as well. And we have Dr. Munoz. She's the medical director at Bridgeport Hospital REACH, REACH program. And I want to just thank you for joining us. And we'll talk about mental health and what it must be and what you're hearing, what people can do, and maybe some hotlines that they can call. Because in the backdrop of this, let's just go through orders of kind of hierarchy here. The biggest and the top priority is to stay alive, obviously. And I don't mean that in any kind of flippant way. As you know, the numbers, every one we see a case where someone's died, it's important. Or to get sick. The other thing is to stay healthy. But in order to do that, sometimes the protocols ask us to, as they do, stay at home, and there's social distancing. And this is not normal for us. It's not normal for us, certainly in our city. We've got, I argue more than 150,000 people here. And we interact every day, and that's kind of the way we do it. And so it's changed. And so coping with COVID-19 in these uncertain times creates anxiety. Doctor, welcome. Thanks for joining us. Why don't you talk us through this? Because I'm just that kind of, I'm the facilitator. Our office is a facilitator for you to talk directly to hundreds, actually thousands of people, things that they may be experiencing in places where they might go for information. So thank you.
Thank you so much. It's my pleasure to be here. May is Mental Health Awareness Month. So it's mental health is very common. It occurs in 1 in 4 people. So if you have symptomatology, you're not alone. A lot of people have mental health issues, and especially during these trying times. So there are a few things you could do preventatively, I think, to help cope with COVID-19. So I'll go over a few of those strategies first, because prevention is the key to mental health in many ways, as well as early treatment. So identifying symptoms, receiving early treatment, and reaching out is really key. Obviously, COVID-19 creates a lot of anxiety, feelings of sadness, feelings of anger, and loss in everyone. When those symptoms become persistent and create dysfunction, that's a time to seek out more mental health assistance. But here are things, let's start off with things that you can do just to cope day to day. Be in the moment, focus one day at a time. We can often jump ahead. Oh my gosh, when is this going to end? And that precipitates our anxiety. So let's try to be mindful. Try to just take it one day at a time, 1 hour at a time. And through this, we will get by. Making a routine. This is so key because so much of mental health is related to our biology and our body rhythm or diurnal rhythm. So even if you may not be working or going out to school, just making sure that you maintain a routine, keep a regular sleep and exercise cycle, as well as healthy eating. It's very tempting to go to the carbs and the sweets as well. Limit news intake. Pick and choose what news you want. So my little routine is to watch a few minutes of a local segment, as well as maybe a world or more national segment. Because news in itself, watching news constantly can create traumatizing symptoms. And instead, alternate that with things that bring you joy. One of my patients goes home every day from work to watch The Jeffersons. It's her favorite show. So, I love Lucy. So anything of that sort, just be, self-kind. And then acceptance that you cannot control everything. This is all out of our control. Be aware of what you can do and what you cannot control. So we can control things like wearing our masks when we go outside, washing our hands, taking precautions, doing social distancing. But we cannot speed up the vaccine or the treatments that will in itself sort itself out. And don't isolate yourself. Yes, we have to physically, socially isolate, but have a daily buddy that you can check in with. daily, whether it's by technology, such as the various apps, or by phone, or even just social distancing with a neighbor and putting a lawn chair out and talking to your neighbor on the other lawn. So that's really key. And be self-kind, praise yourself. Sometimes we can be our harshest critics and our worst enemy. So we would never tell other people the things that we think in our heads. So, really praise yourself just for getting by, doing things, a gratitude journal, or being grateful for things, finding things to be grateful about, give you a big perspective. And the other thing is limited caffeine and alcohol.
I blew that one. I blew that one right out of the water. No, I'm kidding. I actually.
Which one, the caffeine
both.
or the alcohol?
No. I actually haven't, to your point, if you don't think about some of the things you mentioned, you are, me personally, and I'm probably not atypical completely, you are susceptible. I find myself, in other words, when you go through a change like this, if you don't say, okay, I want to be careful on what I eat, otherwise I'm just going to eat junk food, you'll do it. But if you do it just the opposite and you say, okay, now let's get a handle on this, sometimes you can do well. Same thing with alcohol, same thing with caffeine, right? And some of the things you've put out there, if people think about them, they really will start to say, I can do this isn't that hard, and they'll just start thinking a different way. So it's really helpful what you're saying.
Oh, thank you. Absolutely. And it's not complete abstinence from these things. I mean, I need my caffeine to get up in the morning and function. And, a nice piece of chocolate at night is, a self-soothing thing. And then, a lot of us have lost our routines of going to our churches or synagogues or mosques. So, keep the faith. Continue belief-based practices, whether it's, praying at home or talking to your pastor or local, belief minister. Those are really important things to do. And realize that we're all human. We don't have to be heroes all the time. I think there's a lot of pressure, as professionals that it's wonderful to be acknowledged, but we don't have to be heroes all the time. We are vulnerable people, whether you're a police officer, a fireman, the janitor, working in a supermarket or in a government position. These are trying times, and it's okay to admit that you might need to seek out help. So I'm going to talk a little bit about signs of seeking help. What we look for, everybody feels anxiety, everybody feels sadness. That's what makes us human. When those things become excessive and out of control and they start to interfere with what we call activities of daily living, so our ability to take care of our kids, our ability to do our jobs, our abilities to care for ourselves, like bathe and dress and get out and eat, that's when it really becomes very problematic. So if you have these symptoms plus the dysfunction associated with that, I would really suggest you seek out help. So feeling anxious and agitated in a persistent way, behaving recklessly, doing things that aren't really, taking risks that you would have normally not taken, spending excessive money, sleeping too much or too little, eating too much or too little, withdrawing and feeling isolated, even when other people are around you, sort of that sense of loneliness that you can't get out. Extreme mood swings that you can't seem to regulate. Like I said, an inability to inform tasks, having recurrent thoughts about dying, clearly if you're having thoughts about killing yourself, but also just a preoccupation with death that you can't seem to overcome, feeling hopeless, feeling like you're a burden to other people. And if you find yourself, this is a time where you could find yourself using more alcohol and drugs to cope, and that can become out of control. Or you can regress to old patterns that maybe you had fought previously. Those are all signs that you might, you most likely need additional help. So what do you do if you have a family or a friend or a colleague where you're seeing some of these symptoms? It's sort of like the elephant in the room. People are often afraid to speak about this because it's a difficult topic. But please ask someone if they're going through a difficult time, if they're struggling, if they're having thoughts of hurting themselves, are they sleeping? Show your support. Be supportive to that person. Let them know it's all right, and it's that they're not alone in this, and connect them to help. And I believe the last slide that is going to be shown is a series of hotlines and warm lines where you could connect to help. And Bridgeport is a wonderful town. It has so many resources. It's so rich in resources. I just wish that people would utilize them. So there is help out there. You just
Let's
need to
read a
ask.
couple of the phone numbers for the radio audience. I see Greater Bridgeport Community Mental Health Center, which I'm familiar with. If you need to call for help, I'm telling them it's 800-921-0359. That's 1-800-921-0359 from 9 to 9 p.m., right? That's a good one?
Yes. And actually, one of the best ones we have is 211.
211, that's easiest, huh? Okay.
So easy to remember.
Just
If you're
go
going
to
to remember
211.
one, remember 211. You can dial 1 for mental health. They actually can connect you if you have a child or an adolescent. They can
Good.
connect you to the mobile crisis and do an on-site visit. They are a wealth of resources. I utilize them, and I recommend everyone utilize them. The National Suicide Prevention Lifeline is another, 1-800-273-TALK. There are quite a few of them.
What I'm going to do is easiest for them to remember is there's a full list of more numbers on the city's website, and we always promote that, and so that's bridgeportct.gov, so they can get them from there. Just too quick, if you don't mind me, and then appreciate all that you've provided. It's a lot, but it's right on point. The idea, which I think is interesting, because I can't do it, because I'm trying to absorb myself in every detail and nuance of the news so that I can at least pretend to be somewhat educated on this stuff. And I feel if I've got enough media outlets and enough medical experts in one direction, because it's all new, you can't go back to the books of the last study or the last pandemic like this. So I utilize that, but I think you're right. Sometimes you get inundated and it just beats you down, some of the news. So I think it's a great idea to break out. I'm not going to suggest Netflix particularly or any of those, but just something. It could be I Love Lucy, or it could be Moving On Up, right? Isn't that the Jeffersons?
Right.
So those are both great kind of like just, I don't say throwaway shows, but you can just kind of zone out and do that. But if you don't mind, and I hate to end on a serious note, but we're talking about mental health in general. This is kind of like the passive players in this. I mean, aside from this, I'm healthy. I try and stay at home. I go to work. So we're talking to those people, or to us, if you will. But there's also a whole group now of, they're not statistics. They're people that have had a family member who've passed, or someone who's going through this or struggling. Any extra words on that, or places where they can kind of land for additional support? It's such an uncertain time and a difficult time for people, even going through what would normally be an orderly process when you lose someone, or someone or someone getting sick, and the stress on that. People with elderly or with pre-existing conditions. Anything you could say there that might be that extra kind of words of comfort would be helpful, I think, from you, Doctor.
Well, there's so much to be said. Hang in there is what I would say. Have faith. There are, people are staying out of the emergency room. Unfortunately, the emergency room, Bridgeport Hospital, is your local hospital. It's there to help you. If you're having, really extreme difficulty, having thoughts of hurting yourself, the hospital is there for you, as well as a wealth of resources. My program is an intensive outpatient program. It's done through telehealth so that we can assist people who are afraid to leave their home, elderly people or people with medical issues that cannot go out there. And there is help out there. So don't be afraid to ask for help. Keep the faith, take it one day at a time, but reach out to someone, because there are so many people out there that can help you. And you're not alone in this. Everybody's suffering. We're in it together.
Well put, and thank you so much. And again, we'll put the numbers up on the website. Thank you for joining us and spending time with us. And I think it was really helpful for people as maybe they could take a deep breath as they go through this kind of stressful period. So thanks so much.
Thank you.
Bye-bye.
Take care. Bye-bye.
I think that was helpful. Certainly for me, you start thinking through and then realizing that this is all stressful. And these triggers, being laid off, kids at home, there's other stress factors that are caused by the impact of COVID. So don't feel like, oh, gee, there's something wrong. Why can't I deal with this? Why am I feeling this way? Why am I doing ... That wouldn't be maybe the best or healthiest thing for me that doctor talked about. So appreciate it. Now let's get a little upbeat. Let's get a little rhythm here on something that kind of give us something to look forward to. And hopefully will get us upbeat a little bit. Planning to reopen, as we've said earlier, deliberately, cautiously, within all the parameters and metrics. But things that are going to be looking at, we're not going to get into all the details because we don't have time today because we had the doctor on. But tomorrow, I think we'll go through a much more detailed, granular, so to speak, rendition of some of the reopening protocols that we're doing, that the state has laid out, the governor's laid out a lot more details now. I think we should work through that tomorrow. Hopefully we can get it all done in one and let people know what's happening. For instance, opening at 50% capacities. That's hair salons, that's barbershops. What does that look like? Zoos and museums, offices, restaurants with outdoor dining. We're getting calls off the hook. We've done an executive order telling them that they can bypass a lot of what would be the time constraints on getting through zoning and so on for retail and malls. So all that stuff's going to be in play. We'll go through it in much more detail tomorrow. We're going to have specific announcements about lifting the 8 p.m. curfew, the recommended curfew that so many people have not only abided by, but I think can take some pride in the fact that that was one of the measures, just one out of many, the mask another one, social distancing others, that have helped not just beat down this curve, but I think surprised us all as to how far down and frankly how quickly we could see this thing turn in the right direction. Again, with caveats, we're not through this by any means. We're not through the first one, and we want to make sure that we put ourselves in a position to avoid and mitigate anything that might be kind of a reoccurrence on this thing. The other thing we'll be doing is we'll be looking at the golf courses. Those seem to be one of the safest kind of drop points and parks on a limited basis. We want to encourage people, maybe they'll be from 10 to 4 on the weekends, and hopefully we can demonstrate our social distancing and wearing our masks and not kind of over, it'll be just for local residents. And as we do that, we can begin to use that as a benchmark or foundation for more reopenings. So stay tuned for tomorrow. We'll put out some information to let you know, to remind you if you're interested in the reopening, more masks and all that, you should tune in tomorrow, 12:30. For today, though, the testing numbers are up by almost another 1,500. That's a result of more testing sites in the city of Bridgeport. There's over 10,000. There's 10,888. There was 9,409 yesterday, so that's a good increase. I like more testing, more testing. Obviously, you're going to get more positives. That's just a byproduct of what we're doing. That's why we think some of the other metrics or measurements that we're putting up here are critically important for us to be aware of, certainly for me to be aware of, I think for government officials to be aware of, health experts to be aware of, as we make decisions on timing and aspects of reopening. Critical element of this is the hospitals. Their capacity is strong. You'll see our local numbers if you can see the charts. They still hover in that 50 to 60% occupancy rate. With a stronger percentages of available ventilators. That's good. So that's consistent and a critical number for us to know that we have hospital beds, that we have hospital ventilators, they have hospital staff available as we go through this, because you're not going to expect a downtick when we start to interact more. Likelihood is going to be, hopefully we'd love to keep it flat and love to see it go down, but we've got to be prepared that maybe some uptick, and that's what we want to avoid. That's why we're taking such a slow, methodical, deliberate, cautious process. So the number of people that have been directly impacted is, as you'll see, we've got the state, if you can see the chart, you got the state of Connecticut broken up into color codes by county. We focus on Fairfield County, and in Fairfield County, the numbers are down again for another straight day. So what does that mean? It means the amount of people using net hospitals, so called, as discharge rate and people that have gone in. So 5 more people went in the hospital today, and 6 went home. That would show -1. What we're showing for entire Fairfield County is a total of 403 people in hospitals, and that's down 21 persons, or a net of 21 persons from yesterday. That's excuse me, that's a good number. Anything going down is good. Anything not going up is good, but anything going down is really good. This one is black on green. We talked about changing the colors up, but we didn't get there yet. Anyways, it's kind of like purple on black, but it's hard to see. But what it clearly shows is a downward angle, if you can see me, going down. So the pen would be pointed in the direction of the dots. And I would say up for a couple of aberrations, I'll call them, or outliers. We are down well into 7 days, even with outliers. 1, 2, 3, 4, 5, 6. Tomorrow will be 7. But overall, except for there's 2 numbers that are about, or 2 days that are about 7 days apart. 7 days is a week. So that leads me to believe that they may be a accumulation of 2 days, because the only ones that go up, and they continue to do it on our chart every 7 days or every 6 days. So if you can bypass those, because they might be 2 numbers or numbers of 2 days together, you see 14 and 21 days in a row of what I call the net numbers that have been referred to by the state of Connecticut, by the governor, as far as discharge rates. I'm using net discharge and people going in. I think it's a better, and it's frankly the only number we have that's available on those statistics. Other numbers that are, and we're going to put a chart up on this pretty soon too. Fairfield County confirmed COVID persons in Connecticut is 13,276. That number continues to decrease as a percentage of overall for the state. We have 33,554 confirmed. Of that, we're 13,276. That number was as high as 60% of the gross number for the state at one point. So we are going down proportionately. One of the numbers that I can show you too in hospitalizations is we're 403. That number continues to go down. But if you look at as compared to New Haven, we're less hospitalizations now than in New Haven County. They have 421. So that, at least for Fairfield County, which is what we want to focus on, I doubt we're talking to people beyond Fairfield County. We might be a little bit into New Haven County with some of the surrounding towns, but we're really looking at this part of the state. So, and I think our barometer on where we are, because of proximity to New York, we saw our numbers go up earlier. We saw them go higher, but they are now going down, it looks like, faster and at a steadier rate than maybe other parts of the state. I don't know that for sure, but it seems to be on these, so we're going to continue to chart them. But most importantly is what is actually happening today. So we have 2,525 people. Those are confirmed COVID cases in Bridgeport, and 120 people have died as a result of this. 120 people. That's 120 families. So when you look at these national numbers, it doesn't look like a lot. When you look at statewide numbers, it doesn't look like a lot. If you're one of the families or have a family member, it's more than enough, and I'm sure it's overwhelming, and our sympathies and condolences go out to them, especially losing somebody through this terrible, dastardly, difficult disease and the implications that it reaps on families, even going through the mourning process. So let's go a little bit more upbeat on the next one. We got a lot of X's on that, and we're looking at 12, 13, 14, 15, 16, to 20, and that 20 seems like a solid date. It's a solid date here in Bridgeport, and I think the governor's going to keep it as a solid date for the state of Connecticut, which is critically important. He's laid out details for a reopening plan, as I mentioned, that we will go through tomorrow. I won't say in excruciating detail, but in some detail, enough detail to give you a flavor of what's going on, and we've got some time to plan it. And later in the week, I'll be talking to city employees about our reopening plan within city buildings. We've started, if you've been tested and if you're a member of one or more of the offices, we have brought in 1 or 2 more people now. We'll continue to do that slowly under protocols that were discussed with department heads earlier today. Another thing that's happening, schools are already closed. We took that slide down, but Scholastic book packs. Bridgeport Public Schools distributing packs to all students K through 8. That's kindergarten through 8th grade. That's today, Monday, May 11th, and tomorrow, May 12th, at Bridgeport Public Elementary Schools. Book packs are there. Amazing work again in the area of arts. Central High School student art, phenomenal drawing. I can never draw, always admire what they do. CT Central, kitchen, free hot meals. This is shepherded by elected officials. Today, Monday, May 11th, starting at 12 noon, 752 East Main Street. A hot plate of food when it's needed most, hosted by Council President Heidi Nieves, Maria Valle, Councilwoman, State Representatives Rosario and Antonio Felipe. Thank you for your commitment and what you're doing on this as well. We're not going to lose track of the census. Not going to lose track of the census. We're going to keep count. We count on you. You'll see the numbers. Our household response to Census 2020 is below the national average at 58.5%. Is below the Connecticut average, which is 62%. We're at 43.6. Be counted in Bridgeport. The numbers went up. We're going to check our percentages every day so you can add to it. It only takes 5 minutes. Unless you're slow like me, it'll take you 10 minutes to impact the next 10 years. So 10 minutes will impact the next 10 years. Good job on that. I knew you'd get a little rhythm on that. So we're moving and kind of grooving here. WICC 600, thank you for listening. Radio Cumbre 1450, thank you for listening. That's amazing that we got almost through. I want to just say quickly, we would not be supportive, not that we could do anything differently, but we would not be supportive, which we are, of this reopening on May 20th if we didn't think that we were in a good position and that we didn't have good reopening plans as laid out by the state of Connecticut and supported by us locally here in the city of Bridgeport. We're going to start taking those steps slowly, and hopefully people will continue to do what we've been doing. We've reduced and saved lives, literally. I know it sounds like those cliches, you save lives. But really, those numbers, if any of those multiple of models, and they were all saying the same thing, whether it was in Connecticut, whether it was nationally, was in New York, that there were tens of thousands of more people that would have been victim by now. And because people staying home, because of measures that were taken on all levels, and some of them, took a while to kind of come to fruition, and some people said, oh, you're too early on forcing people to do this, and curfews and wearing masks and all that. But we need to continue it now. We're in the midst of it. We've got a lot of hard work and accomplishments under our belt. We got a lot of work ahead of us. This reopening plan has to be done right. We'll lay out the parameters for it, but people have got to respond accordingly, or we'll take a step back, and I will tell you, we'll unfortunately take it back quickly. And it won't be just me here at 12:30 to 1 o'clock talking about it. You'll be hearing it from all the healthcare providers. You'll be hearing it from all the elected officials all in unison. We don't want that. We want our freedom, but we want it healthy. Thank you. In this together. We'll talk again tomorrow.